Your participation is the key for success in your recuperation. Ask for assistance when getting out of bed and inform the staff if you are having any pain. Whatever your needs may be, the medical staff at Oak Hill Hospital hopes to not only meet your needs, but anticipate them. Now, for those of you who are having a hip or a knee replaced, just know there will be no lounging around. We have to get you up and moving as quickly as possible. Why? Because we have to keep you a few steps ahead of pneumonia and blood clots. So after your surgery, we'll have very busy mornings around here at the Institute. First, when you wake up in the morning, try to figure out where your pain level is. If it's high enough where you need your pain medication, let the nurse know as quickly as possible so that by the time the rehab team comes into the room, your head is cleared up a bit. If you're a little bit lethargic, we may not be able to get you out of bed because we want to avoid any unsafe situation for you and your therapist. If you come up from surgery early enough in the day, you may at least get to the edge of the bed that day. Remember, the day of your surgery is the start of your recovery. It's not unheard of for hip or knee replacement patients to get up the day of surgery. Again, we've got to get you moving. Some patients lose their appetite because of the exposure to anesthesia, but this is not the time to be finicky about what you eat. You need your nutrients, calcium, and proteins for your body to heal. Joint replacement surgery has changed over the years. These days, surgeons are going around the muscles instead of cutting through them. This means you're only recovering from one thing, not two. The implant used to last between 8 to 10 years. Now with the change in technology and materials, they're lasting up to 20 years. Implants used to be one size fits all. Now there are larger sizes for men and big-framed women, and smaller sizes for women and smaller-framed men, so the sizes are more appropriate. When you come into the hospital, we will give you a booklet where we have illustrated several exercises that we are going to have you do. Whether you're a knee replacement or a hip replacement, we're going to teach you these exercises. You will take this booklet with you to the next phase of your recovery, whether it's a rehab facility or at home with home health. The important thing is that every time you correctly demonstrate one of these exercises, we will initial them off. Then you can show that to your therapist at the rehab center or at home to allow them to see where you left off. For those of you who are having a knee replacement, every time you replace a joint, you have to get its natural movement back. Whether it's flexion or extension, we will help you. For those of you who are having a hip replaced, there are some precautions that you're going to have to observe. Your surgeon will determine the length of time that you will have to observe those precautions. These precautions include not being able to cross your legs or turn your toes in, not being able to go beyond 90 degrees once you're sitting, and not being able to lean forward. This is not for the rest of your life, it's just for the amount of time that your surgeon determines. We cover the hip precautions in the booklet that we give you. We also review it with you every day, so by the time you get home, they'll be stuck in your mind, and you'll be at a higher level of independence and safety. On your first day of post-op, you will see one of our social workers or a nurse case manager. If your surgery is early enough in the day, you may even see them the same day. They will ask you a few quick questions in order to do an assessment. They may ask you to tell them where you live, who you live with, if you live by yourself. Do you have any friends, family, neighbors, anybody that checks on you? Before coming to the hospital, could you do things for yourself? Could you dress yourself? Could you shower for yourself? Were you using any equipment to get around, like a walker, a cane, crutches, a wheelchair, and do you have any equipment already at home? And then they'll talk to you about what you will need for discharge in terms of equipment and rehabilitation. What kind of equipment will you need when it comes time to discharge from the hospital? The first piece of equipment is called a rolling walker. A rolling walker is basically a four-legged walker that has two front wheels on the front and standard legs on the back. You may have seen walkers with additional wheels, seats, and brakes. Unfortunately, those are a fall risk and will not be used during your rehabilitation. The second piece of equipment is called a 3-in-1 commode, traditionally known as a bedside commode. The hope is that by the time you're discharged from the hospital, you're able to transfer yourself and walk enough distance to get to your bathroom. So how will you use the bedside commode in your bathroom? When you get home, have someone unscrew the tub off the bottom of the commode, go into your bathroom, raise the commode lid, and place the bedside commode over your commode. Now you have a handicap-accessible bathroom with bars to help you get up and get down. It's also more elevated, which is very important for those having a hip replacement. The insurance company will purchase the walker and the bedside commode for you. Once it's time for discharge, you will have a few options when it comes to physical therapy, and you'll need to let us know what course you'd like to take. Your first option is home health care. Again, with this option, you go home when you're discharged from the hospital. Then, a home health company will send a physical therapist to work with you in your home. They also have access to nurses that the doctor deems as appropriate. You'll also have a nurse that will follow you at the house as well. If you decide to go with home health care or outpatient physical therapy, insurance typically pays for 3 times a week for the first couple of weeks. Then it goes down to 2 times a week and then 1 time a week. Everyone will progress differently, so if you're struggling with your therapy, that home health company or outpatient can contact your insurance company and see if they're willing to give additional visits. The second type of physical therapy is outpatient physical therapy. With this option, you go home at discharge. When it's time to do therapy, you get into a vehicle, drive to a facility, do your therapy, and then you go back home. While this is not ideal for 3 days after surgery, you do have this option if that's what you'd like to do. Your third option for physical therapy at discharge is inpatient rehabilitation. With inpatient rehab, once you are discharged from the hospital, you do not go home. Inpatient rehab will have to be discussed with your surgeon. Thanks for trusting us to help you with your rehabilitation, and good luck.